All right, we are going to go through a lower quarter screen, which is something that would be good to go through with any lumbar spine or low back complaint, as well as any hip. So again, we want to clear the joints above and below, okay? So I am looking for quality, quantity, provocation. So how well does it move? How much does it move? Does it cause any pain? All right? So I am going to look at Chase's flexion, so bend forward as far as you can. And I'm looking to see how much he moves, how well he moves, and does that bother you? Okay, come back up. And then put your hands on your hip, and then come back into extension. Good. Come back up. Does that bother you? Okay, now face me so that the camera can see. And usually I'll be right behind the patient, but for the video's sake. So I'm going to ask him to put his hands at his side, slide your right hand towards your right knee, and I'm making sure he doesn't go into a flexion. And then come back up, and then slide your left hand towards your left knee, and then come back up. Good. Any problems with that? All right, so now I'm going to have you lie down. And I'm just going to take him through some leg movements because I need to clear the lower extremity. Bring this leg down. Yeah. So I'm going to bring him up. And if you'll notice, I kind of have his heel cupped, so I'm checking ankle range while I'm checking knee and hip movement. So I'm going to bring him up. Is that okay? And I go ahead while I'm here, I sneak in a little bit of a scour and say, okay, assess that for pain. You okay there? And here. Good. So I've done everything for lower extremity with that one little swoop. All right, have a seat. And I'm going to test both sides, but for today I'm not. But I always test both sides. Okay, so then I'm going to raise the mat up just a little bit. And I'm going to test sharp, dull, and light touch. And remember that sharp, dull tests the spinothalamic tract, light touch tests the DCMO. And I'm not going to give him an example on his legs. I'm going to give him an example on his hand. So here's sharp, here's dull. Do you feel the difference? Okay, and remember we are taking our pressure and moving our thumbs down. That ensures that we give an equal amount of pressure. And I'm going to use the Asia key points. So can you bring your shorts up just a little bit more? Yep. Okay, so we're going to start with L2, which is midway along the thigh on the medial side. Okay, so close your eyes, good. So sharp or dull?
Sharp.
Sharp or dull?
Sharp.
And then L3 is medial knee, sharp or dull?
Middle.
Sharp or dull?
Sharp.
And then L4 is medial malleoli.
Sharp. Dull.
Okay. L5 is the great toe.
Sharp. Sharp.
Okay. S1 for the Asia key point, S1 is the lateral calcaneus, but it can also be for the MPTE, it's the lateral side of the foot. So anywhere in there is acceptable for S1.
Sharp. Dull.
And then S2 is the popliteal fossa, the middle of the popliteal fossa. So
sharp, sharp,
Yeah. Okay, so then I'm gonna do the same thing with light touch, and I'm gonna say, can I please have your hand? I'm gonna do a little sweep, okay? And so make sure, when you are testing a dermatome, that you are not, one, painting, and that you're not crossing dermatomes, because our dermatomes run in this manner. And so we don't want to confuse the signals, because a dermatome is innervated by one nerve root. Okay, so close your eyes. Tell me if it's the same on both sides.
same, same,
And I'm using the same
same,
key points.
same, same, same.
Okay, all right, now we can test our reflexes. So the quadricep reflex is L3-4, and the Achilles tendon reflex is S1. And again, you're not going to hit and hold, you're gonna give a rebound with the reflex. Ooh, okay, that was a 3+. And usually for my beginning students, I will tell them this. If you will cup the patella and get your fingers at the end of the patella, then you won't hit the bone. You'll hit the tendon. And so you can do that on both sides. Okay? And then we will do the Achilles tendon. And so I'll bring my patient into dorsiflexion, and Chase knows exactly what I'm doing, but most patients will hold their foot up and try to help you. And so I put my thumb over the anterior tib until they relax, and then test. Okay? Good. So those are my lower motor neuron testing. And then to test a Babinski, I will have them come out, and I usually just hold them because I don't want anybody kicking me. And then if you remember, it's a sweep from the lateral side of the foot and across the metatarsal pad. So we're gonna go here to here, here to here. And you see a little spreading, and that's okay. Yeah, he did a little flexion, because what you want to see is flexion of the toes. And I kind of think the way that I remember it is, ooh, I don't like that, so I'm going to flex my toes and kind of get away from it. And abnormal response is splaying and extension of the big toe. So, yeah, I know. So then we do the other side, and so I just prop him up and do a little scrape, and he's good. Okay, so that is everything except the myotome testing. And so remember, we're going to hold the myotomes testing for at least 5 seconds. So I'm going to let him have his feet on the floor, and I'm going to let him put his hands on the mat, so that he's not having to work his abs just for me to test his hip. So I'm going to bring him up. That's his range. I'm going to bring him mid-range, and I'm going to ask him to hold that. Good. And then I'm going to do the same thing. Full range, mid-range. Hold. Good. Okay, so that's L2. L3 is quads, so we're going to kick out, full range, come back down just a little bit, hold it right there, and usually I'll cross here and get them to hold. Good. And then I'll do the same thing on the other side. Full range, come down, hold. Okay, so we've done L2, L3. L4 is anterior tib, which does dorsiflexion and inversion. So hold right there. Don't let me push it down. So then my force is plantar flexion and eversion. Okay, come up and in. So plantar flexion and eversion is the direction of my force. Okay, and then we can do great toe extension for L5. Lift your toes up. And you're not trying to overpower the big toe. You're trying to see, can you fatigue it? And does it fatigue? Are they equal? Okay. S1 is plantar flexion. So point your foot down like it's on a gas pedal. Good. Point down like a gas pedal. Good. And S2 is hamstring. So knee flexion, pull back. Good. Pull back. Perfect. Okay. So that is your lower quarter screening.